Hello, I am Khalid Mumtaz and I am working as a transplant hepatologist at Ohio State University Wexner Medical Center. My job here in the field of liver transplantation is to manage patients with end-stage liver disease due to various etiologies. I see patients who have acute liver disease. I see patients who have chronic liver disease and sequela of chronic liver disease in the form of cirrhosis of liver and its various complications. I also assess patients with advanced liver disease who are candidate for liver transplantation. I'm also involved in assessment of donors for live donor liver transplant at Ohio State University. Patients with cirrhosis of liver develop different complications, including ascites, which is accumulation of fluid in the belly, hepatic encephalopathy, which is manifested in the form of confusion, disorientation, and even coma. Patients with liver disease also develop liver cancer. We call that as decompensated cirrhosis. Decompensated cirrhosis are usually assessed based upon their MELD score for their severity. MELD score is a score which is based upon the liver function test and the kidney function test. This score ranges from 6 to 40. Once a patient's MELD score reaches to 15, there is a benefit of liver transplantation. The score is helpful in predicting 3 months mortality without liver transplantation. Once somebody's MELD score reaches to 15, there is a 10 to 15% chances of dying within 3 months without a liver transplantation. When the score reaches to 30, there is a 30 to 40% chances of dying if they are unable to get a liver transplantation. There are two major ways of getting a liver transplantation for these decompensated cirrhosis patients with high MELD score. One is deceased donor liver transplantation, where we get the liver from the deceased donor and give it to the patient who is on the wait list with highest MELD score. Other way of getting a liver transplantation is live donor liver transplantation, where we ask our patients or the recipient to bring their own donor, and then we can arrange a surgery after the assessment of donor for the donation process. In the United States, approximately 95% of transplants are performed with the help of deceased donor liver transplantation, where liver is procured from a deceased donor and allocated to a recipient with high MELD score. In approximately 10 to 15% of the patients, the MELD score is low and not reflective of severity of liver disease. In those situations, live donor liver transplantation is a useful modality in patients with decompensated cirrhosis and low MELD score. Live donor liver transplantation has also benefit of avoiding waiting on a wait list for an offer for deceased donor organ. Live donor liver transplantation can be offered before a patient gets too sick to get a transplantation. Principle of the live donor liver transplantation is based on the fact that liver has capacity to regenerate and achieve full size and function capacity in the donor and recipient in approximately 3 months. Currently, approximately 14,000 patients are on the wait list for liver transplantation in the United States. Approximately 7,000 patients get a liver transplantation every year from deceased donor. This means that the rest of the patients have to continue to wait for an offer of a deceased donor liver transplantation. Those waiting will get sicker and may not be able to get a liver transplantation. Approximately 1 in 5 patients, that is 20% patients, die while they are waiting for a deceased donor liver transplantation. Therefore, the need for living donor liver transplantation in United States is evident based simply on supply and demand of deceased donor organ. Live donor liver transplantation is a successful option for liver transplantation and provides option of getting a liver transplantation before a patient getting too sick. Live donor liver transplantation is the major source of liver transplantation in majority of Asian transplant centers, including China, Pakistan, Japan, South Korea, India. However, only less than 5% of the transplants are performed using live donor liver transplantation in United States. This proves the point that this source of transplantation has not been tapped appropriately in this part of the world. In order to be a good candidate for a live donation at Ohio State University, we consider a donor who is generally healthy, without any chronic diseases such as diabetes, cancer, hepatitis, or HIV. The donor must be between 21 to 55 years old and must have the same blood group as the recipient or blood group O, which is considered a universal donor. Live donor candidate has to undergo a series of testing, including blood work, imaging of the liver for the assessment of anatomy of liver and its vasculature. The donor has to be seen by our transplant team, including hepatologist, transplant surgeon, coordinator, social worker, donor advocate, and other team members. We make every effort to ensure the safety of the donor first and benefit to the recipient.